good morning to all of you. I hope that you must have been a very pleasant stay at Varanasi. Basically, I am working at the Interdisciplinary School of Life Science, and I am by profession I am a basic molecular biologist. And earlier I was at the University of Pittsburgh Medical Center working in the area of infectious disease for around 8 years. But when I came to THU, so I just met Dr. ALzheimer and I got motivated to work in the area of cognitive science, considering its scope in coming future and the acuteness of the problem. Because in India, a lot of elderly population is growing up, and according to the World Federation of Neurology, the recent reports which are coming up is showing that this area has got a big challenge in the near future. So we have concentrated ourselves along with the Department of Neurology, IMS BHU. So we started working in the area of mild cognitive impairment, which further leads to the, in severe condition, leads to the Alzheimer disease. And as you all know that there are no biomarkers available still in the clinics by which you can diagnose Alzheimer disease at early stage. So keeping in this view, we wrote a project and I got that project sanctioned from Department of Science and Technology. So coming to the lecture, I will just show you, this is the, basically all the data is being taken from this data from the World Federation of Neurology, and it shows that in the aging population we have the three main problems, and that is stroke, Alzheimer's and Parkinson's. And if you see, like the global share of the older people which are more than 60 years is around 800 million, around 12%. And by 2025, 80% of older population will be living in less developed countries. So since India is also a less developed country, developing country, so we are going to have a big challenge in this problem. So considering its financial and medical dispense in this area, this problem has been taken by Department of Science and Technology also very seriously, and they have opened a new department called Cognitive Science Initiative. And Dr. Suresh is there, and he is one of the members at that task force, and they are promoting cognitive science research in India. So coming to the introduction, like you see that NCI is the early stage in which the forgetfulness, disorientation, executive problems starts. And further, if it is not taken in care, it leads to Alzheimer disease. And the prevalence is in the developing country is growing very fast, and there are very few reports available of the prevalence at the pathological level as well as the diagnostic and clinical studies are very less. So we have designed this study in which we have collaborated with Department of Neurology and Department of Geriatrics. In BHU we have a Department of Geriatrics also, which have recently been started. And what we are doing that all the elderly population which are coming and have some problem of forgetfulness or some disorientation, so we are screening all those individuals with the help of the neurologist, with the help of expert psychologists, as well as psychiatrists is also taken into care, and they all are helping us together in order to screen those patients that whether they are the subjects of MCI or not. And the psychological test which we are using is Hindi mini mental state examination, because that is one of the best tests I think that can be understood by the patients and is very good help for the counselor also, because the counselor can do the counseling in the minimum time. Because in our hospital we have a lot of overload of the patient, it is not possible to take any other criteria for the assessment. So we are using this test for the preliminary screening, and after screening our patients, we just do MRI, and in MRI we are using diffuser tensor imaging, because diffuser tensor imaging is one of the best technique nowadays which is being evolving very significantly, and that is showing that what are the changes in the white matter which is connecting to the grey matter. After doing the DTI imaging, if we get some changes in white matter as well as in grey matter, then that subject is considered as an NCI subject. Sir. So, coffee. After that, we do lot of biological, like we are doing proteomics study in that. We are also doing some genomics microarray based study, that what are the changes in the protein or gene level, so that we can really identify that what are the genes, proteins and as well as at imaging level, because imaging is the best tool, I think, which is very helpful in the near future, going to be a promising tool by which we can develop a very prognostic marker for the MCI subject which are going to be an AD in future. Maybe they can be suffering from Alzheimer disease. So at early stage we can, if we detect that a person have some changes and have some have high incidence that will change to Alzheimer subject, so we can prevent it at early stage. So coming to the result, if, from all the, we have basically considered 100. I came last year in November in BHU, and till now it is like 1 year have been gone, and we have at least screened around 5 to 10,000 patients, and from 10,000 we have just screened 100 samples, and in 100 samples the data is of 100 samples, and in that what you can see in the first graph that the it is like on the y-axis you will see the prevalence in the, and on the x you will see the age. The maximum prevalence you will see in the age of 60 to 69 years, and if you will see the MMSE score on the y in the next figure, you will see that the MMSE of the subjects of MCI is like greater than 18 and less than 24. If it is around 24, greater than 18 and less than 24, then that in mini mental state examination, then we consider that subject as mild cognitive impaired subject. So we have also considered, by collecting all the demographic data and all the type of data, that what are the different factors which affect the onset of cognitive decline. So we have found, as you can see in the graph, like the maximum population, because it was being conducted at Banaras Hindu University, a lot of people from this urban nearby area are also coming. So living in the cities, people who are living in cities are more as compared to in the rural areas, and it is also the lifestyle is one of the confounding factors that is being playing a very important role in the onset of MCI. And this is the data. Basically we have done the diffusion tensor imaging, and you can see that all the things, all the square brackets in red are the changes which has been identified by the expert radiologist using the specific software, where you can see that the changes has been significantly found in the MCI subjects. So it shows that DTI has got a lot of promises in order to identify the disease at an early age. So coming to the conclusion, what we found is this, that the size of the hippocampus has been reduced in the MCI subject, as well as there is loss in the grey and white matter as compared to the healthy control. And we found in our whole observation that in the case of this neuropsychological test which we do for this cognitive decline, we have to do a lot of improvement in that, because all that tests which has been reported in the literature, either it is MOCA or ADS-COG or mini mental state examination, most of them have some this way or that way have certain problems. And while we are working within the clinics with the patients, the language is one of the main problem, because the patients which are coming from the rural area, they don't understand the questions, so we have to talk them in their local language, and we have to modify the test, we have to make them explain. So this basically play a very important role in the assessment, because it fluctuates the total score. Because we ask them 10 questions and the total marks is 30, and out of 30, if it is coming 24, 23, we consider that subject MCI. But sometimes it happens that the patient is not understanding or is more smart, giving a very answer by which we have to give him a score, or we have to give him not to give the score. So I think that in this neuropsychological test, lot of improvement has to be, we have to go for that, so that we can develop a better battery for screening of the patient. And the thing which I felt in my whole observation is that DTI, diffusion tensor imaging, can be a very promising tool in the near future, as well as, sir, we are also focusing on positron emission tomography. We are trying to develop with the chemists some radio label compounds, so that, like you know, the CRISPR compound B has been very significantly used in America, but here the patient cannot afford that thing. So what we are doing, that we are trying to collaborate with DRDO in mass, And we are trying to, if like for example, if we have identified a very significant number of samples or the subjects, so we are trying to collaborate them. We can send that, if the patient is ready, we can send that patient and we can do its PET there, and we can confirm our result whether it is same or not. So this way we are trying to use imaging technique a lot, so that we can develop a more imaging marker for MCI which are vulnerable for LD, AD in the near future. Because I think that in India it will going to be a big global problem. So in that context we have been working on, and these are the basically the collaborators. Professor M.K. Thakur is professor and head department of geology and also the coordinator of School of Life Science. And Professor IL is always being a mentor, because whenever I come with some problem, he gives me a very positive answer and he motivated me for doing research in cognitive science. Professor Vijay Nath Misra is professor of neurology in IMS BHU. Professor Deepika Joshi is also professor and head, and she also helps us in finding the patients. Professor R.M. Chaurasia is also in neurology, and he also helps us in screening for the patient. And Dr. Abhishek Pathak, I would like to emphasize on Abhishek Pathak, because he is very dear friend of mine, and he is a DM from AIMS, and he is a very enthusiastic researcher. Whenever I call him, he come to my lab in the late evening, in night also. And most probably the two students, Smriti Singh, who have done MTech in biotech, and she is working hard in the area of neurotoxicity. And Vinita is the main girl, which is working very hard day and night for, because she is the only one who has created the batteries and going to the patient, collecting the blood, doing